The news about COVID seems to be changing every day. The vaccines, who's getting them, new strains, who's the most vulnerable.
So today's Eye on Health focuses on the very latest information we need to know to keep ourselves and all of our loved ones safe.
Dr. Brian Parker, the Chief Quality Officer for Allegheny Health Network, joins us live because just like you at home, we have some questions too. Dr. Parker, thank you for joining us.
Good morning.
So I know that there's been some criticism about the vaccine rollout across the country. This is not aimed at any one individual person, organization, but across the country. So where are we locally with the vaccination process?
Yeah, so in terms of what we've received here locally in greater Pittsburgh area and across the state of Pennsylvania, like we saw in other places in the country, it started out slow. And it was complicated a little bit by the fact that we had 2 long holiday weekends in a row. So Pfizer was, wanted to make sure that the shipping of that vaccine went out flawlessly without any delays over these 3-day weekends. So I think now that we're on the other side of the holidays, we're going to see a ramp up both in terms of distribution and the ability for us to ramp up vaccination across the hospitals at a much greater pace.
Yeah, and Dr. Parker, who has received it already here in the area and who is next in line to get it?
Sure. So it's the way the state has broken this down is we're in what's the 1A phase, and that is for healthcare workers in hospitals and then other acute care and ambulatory settings. And then it's also for long-term care residents like nursing homes and rehab facilities and those healthcare workers as well. That's phase 1A. And then afterwards, phase 1B contains folks like first responders, critical workers in the utility and power industries, critical manufacturing like medical supplies, PPE, and vaccines, and then folks over the age of 65 with and without significant disease that could make their outcomes worse as a result of those diseases.
Dr. Parker, I'm hoping that you can address something that I know is on the minds of a lot of people. Even the name Operation Warp Speed, it signifies how fast this was done. Whether or not they want to get the vaccine. Are you seeing any side effects, and what should people at home know about this?
So, as we talked about before, the side effects are pretty rare. And most folks with the first dose of vaccine don't have very much in the way of side effect. It's typically what we've seen so far for the thousands of people that we've vaccinated. A sore arm is pretty typical, and that's about it. What we're really expecting and what both Pfizer and Moderna saw in their vaccine trials was after the second dose is your body has sort of been primed with that first dose to respond to it in a way that shows that your immune system is actually ramping up and reacting in the appropriate way. So that might mean a little bit of fever, it might mean some aches and some pains in the joints for a day or so, and it might mean some fatigue. But we don't want that to discourage folks from getting the vaccine because it's proof that it's working. And for a day or so of feeling a little bit, down, is way better than ending up in the emergency room or the hospital with significant disease because of COVID.
That's for sure. And Dr. Parker, how can you determine for yourself which vaccine you want to get? Are they both effective? And what's that process like? I know you have to wait a few weeks. Tell us more about each one.
So the 2 vaccines are essentially equivalent in terms of their performance, which is about 94 to 95% effective, which means anyone who gets either of those vaccines, only 5 in 95 will potentially get symptoms of COVID, and the rest of the folks will get either very mild or no symptoms at all. So very, very effective. In terms of choice right now, because we're in that 1A phase, and the distribution that's occurring through the state, we don't have really a lot of choice in what we're getting. As time goes on and other vaccines come to market, there may be choice just based on the ease of being able to provide that vaccine to folks. So right now, the 2 most complicated vaccines to both ship, store, and administer are really focused inside healthcare facilities. We're hoping that we'll see those other 2 vaccines from AstraZeneca and Johnson & Johnson come to market relatively soon, sometime here in the spring. And both of those have very, significantly fewer restrictions on how they have to be stored and obviously a longer administration period.
Okay. Dr. Parker, thank you so much. I know that you reiterated some stuff that you've already touched on in interviews with us, but important information to get out to folks at home.
Absolutely. Thanks again.
Thank you.
And remember to keep watching our Eye on Health series right here on PTL. It happens every Wednesday, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.